let's do some questions right now. We'll start off, this is kind of a simple one. It's not kind of a true extended vignette, as you'll notice, but still, there's some very kind of concrete questions that come up on the exam that I cover in this, in this particular scenario. So it's a 33-year-old woman who presents to an outpatient psychiatric clinic for evaluation of diminished interest in all her normal activities for the past 3 weeks. Upon talking with the patient, you discover she's also sleeping more than usual, having problems concentrating at work, and experiencing feelings of worthlessness. She denies wanting to harm herself or others. It's the first time she has experienced these symptoms to the degree she is currently. She denies any flight of ideas, feelings of grandiosity, or history of high-risk behaviors. Her medical history is negative. She admits to smoking 1 pack of cigarettes per day and expresses interest in quitting. She denies any illicit drug use or alcohol use. Given this information, which medication would be the best initial medication for this patient? So, just kind of think about it. There's obviously, again, it's one of these questions that there's a reason for the right question, like why you should choose, in this case, one. But that doesn't mean it's really the only one. But, if you look at one of these medications that you think it's kind of right, like you're feeling pretty good about it, you can always return. Remember, you do have enough time to return to the vignette and say, why would that be a good case? And there are a couple of things about this case that really do push people, or could push a clinician to choosing one over the other ones. The patient also reports that she has gained weight recently due to her depressed state and wanting to feel better. She would like to consider medications that do not lead to weight gain. Which of the following medications is associated with the least weight gain? Choose one. Okay, so that's pretty straightforward. It's kind of like, a fact-based question. 3, the patient adds that she is in a new romantic relationship and asks if she can get an antidepressant that is low in sexual side effects. Which medications are you most likely to consider? Choose 3. Bupropion, duloxetine, fluoxetine, mirtazapine, or vortioxetine. All right, now let's go over it. So why is bupropion the best? Well, she's feeling kind of lethargic, right, low on energy. So bupropion it's not the only kind of more activating medication, but it is activating. It's less likely to cause, increased sleep or, that kind of cause that kind of a problem. And tranylcypromine, as the MAOI, it's also quite activating. And, if she were really on low energy, that might be a good choice. On the other hand, it's an MAOI, and this is the first time she's been depressed. She's not been on other medications. Are we really going to go to an MAOI? No. So then that falls by the wayside. And also, what else does she show interest in doing? Quitting smoking. So bupropion, it's also indicated for and improves the chances of successful smoking cessation. She also reports she has gained weight recently. So bupropion, out of these options, is the lowest in weight gain. In fact, the other ones are actually among the highest weight-gaining antidepressants: duloxetine, escitalopram, mirtazapine, and paroxetine. And then she adds that she wants you to consider something that will not interfere with her sexual drive or cause any kind of sexual side effects. So the ones that are least likely to cause sexual side effects are bupropion, right? Its actions are not through the serotonergic system. Mirtazapine, it's an antidepressant that's serotonin 3. In addition to its other effects, it's a serotonin 3 receptor antagonist, and so is associated with low sexual side effects, and so also with vortioxetine. So again, very kind of simple, straightforward questions, but these are the kind of things now we need to think about, not just by class, like, okay, we got SSRIs, SNRIs, MIOs, tricyclics, because maybe that's not the main kind of thing pushing you towards a certain answer, but it could be, again, kind of both the side effect profile, let's just say this, the kind of biological activity profile, both benefits and adverse effects that might be moving you towards certain meds and away from others. So, for example, she might say, I'm so tired, I wish I could sleep. Right, that would be common, and then it's like, well, what are the most sedating antidepressants? Let's take advantage of those. Same kind of thing, maybe the case would be a young man with, very depressed, and he's really depressed, part of like the way the reason he feels worthless, because he's a premature ejaculator, and he feels so embarrassed, and he's been so ashamed, and that's really weighing on him. And you're like, well, let's do paroxetine, right? It's a good antidepressant, and also can actually delay ejaculation. Of course, it could lead to anorgasmia, inability to ejaculate if the dose is too high or the patient is too sensitive.